Am I happy today? Heartful living at the source. February 28, 2022. Today is the last of our 8-week series, which we have continuously done since 2015. Now we are a group clinic formally offered at the Truman VA Hospital in Columbia, Missouri. And we've always had the luxury of inviting community patients and friends to join, thanks to our VA leadership accommodating it. And we have helped not only ambulatory heart patients, we have helped their children and grandchildren. And in the last 3 years, we are finding that these methods might actually help acute decompensated heart failure patients in the hospital setting as well. So that's what we wanted to quickly touch upon. My disclosures are the website, High Life Journey, that you see below here, where all these lectures are made available for free for everyone to access anywhere in the world. And Seeking Hunger is a book which is currently available in the US and some other countries, but not yet in India. And this book is only a 30-page quick read, just to tell people why it is important to connect with your own inner nature using hunger as a tool. I'm an advisor at Cardiac Wellness Institute, which is run by my sister Priya Chokalingam in Chennai. And this is what we wanted to quickly touch upon. Heart failure of obesity, what is it? What is mindful eating? And does Siddha directly lead to happiness? This is what acute decompensated heart failure means in the current day and age. More than 1 million patients are hospitalized in the US, another 1 million patients in Europe. The rest of the world, there are so many more heart failure patients. A majority of them are suffering with excess fluid buildup throughout their body, especially in their lungs, making it hard to breathe. Rehospitalization within a month is 24%, and within 3 months, a third of them are hospitalized and 10% lose their lives. So this is not a benign problem. Within 1 year, a third of patients lose their lives, and by 5 years, many people have risk of losing life. This is more malignant, unfortunately, than many cancers. The burden of this heart failure is not only with the heart. Mobility issues in 2/3 of patients, pain and discomfort, carrying out daily activities are a huge challenge, and taking care of themselves and coping with stress and anxiety in 50 to 65% of patients is a big challenge once heart failure settles in. There are 2 types of heart failure based on the heart squeeze. Ejection fraction is normally at 65%. When it is below 45, we say heart failure with reduced ejection fraction, and the heart gets dilated and weaker. And that happens from heart attacks and from alcohol and other problems, where we have several medicines which improve the outcomes. Whereas in half the patients, we see the ejection fraction is closer to normal, and the heart size looks okay and it's squeezing fine, but patient has heart failure with preserved ejection fraction. Unfortunately, we don't have any specific treatment in 2022 that will help improve the natural history and prevent the risk for rehospitalization and mortality. So this is where we are throughout the world. Despite all the advances, half the heart failure patients who have normal squeeze, we don't have any effective therapies. Going back, we know that health, only 25% all along has been with the drugs and interventions and procedures. Majority of our health throughout our lifespan, despite every advances in science, has been with our own lifestyle, environment, and our diet. This is important. And that's why since 2008, we have focused on home-based cardiac rehabilitation in our Truman VA Hospital in Columbia, where disabled veterans who cannot walk because of back pain or stroke or so many other challenges, they take to arm weight training and arm ergometry to try and improve their heart strength. This we've been publishing well before COVID started. Since 2010, we've been reporting these findings. And what we see here is exercise time from 18 minutes goes up to 25 minutes. As you increase the workload on this arm ergometer every minute, we are seeing dramatic improvements within 3 months after doing this home-based program. So all this we are publishing. What we want people to recognize is, how do we measure weight and BMI? BMI up to 25 is considered normal, up to 30 is considered overweight, and beyond 30 BMI is considered obesity in the US. Unfortunately, if you are from India, Pakistan, or Bangladesh, BMI of 23 is considered overweight and over 25 is considered obesity, because people from Southeast Asia have risk of diabetes and heart attack even with very little excess weight. That's why they have much strict criteria. That same thing manifests in a formal pant size or waist circumference. For men in the US, it is 40 inches and women, it is 35 inches. Again, if you are from Indian subcontinent, for men, it is more than 35 is considered risk. For more than 31, waist circumference is considered excess central adiposity and risk for heart disease. If you have the luxury of measuring actual body fat percentage, which is a true measure of excess fat, more than 15% is unnecessary for men and more than 25% is unnecessary for women. So we can move towards this. 15 to 20% in men and 25 to 35% in women is what we are targeting for the most part. Unfortunately, over the last 5 decades in the US, from 10%, obesity has climbed to 35, 40, and now moving towards 50%, where we are talking about BMI more than 30. It's not overweight. Overweight and obesity, if you combine, we are already at 70 to 75% of the entire US population is dealing with excess weight. But obesity, where it is a health issue directly affecting our health, is moving towards 50% within the next few years. Comparing to the rest of the world, where does the United States stand? Japan, it's at 3%. In Europe, it is about 12%. And in the United States, we are head and shoulders above every other country in this world at 35% of obesity already. This is a study done from our own University of Missouri. Dr. Alpert, who's credited with this research for the last 20, 30 years. What he has shown is when people are excess weight for over 15 years, the chance of the heart being affected is 20%. But if somebody has excess weight, severe obesity, which means BMI is more than 35 or 40 for a duration of 20 to 25 years, then the chances of the heart being affected goes up to 95%. So if someone has been dealing with severe obesity for a long time, we really need to look at this as a specific reason for heart getting stiffer, independent of heart attack or hypertension or other problems. Excess weight can lead to heart failure. There are so many diets in the world. So certain diets like the DASH diet, plant-based and Mediterranean diets are proven to reduce the risk for diabetes and heart problems. But the challenge is adherence. When anybody starts a diet, within few months, majority give it up, and by a year or two, nearly everybody has given up any diet. So we end up eating only what we anyway eat. So how do we make a change? We know from science that if we lose dramatic amount of weight, about 20% of our weight, our risk for heart failure and people with changes of heart getting stiffer and lungs pressure going up, all of that gets better. Heart output gets better, stroke volume gets better, pressure in the lungs get better. But this type of weight loss in the Western research is only through gastric bypass surgery so far. So we have to take out most of the stomach, and the gastric bypass does not remove the weight in the body. Because of surgery, people are eating much, much lesser food. It's because they're not able to tolerate outside food. The liver goes into natural ketosis, and thereby we are able to see dramatic weight reduction. Now, look at this 65-year-old friend of ours who came in with acute heart failure, not able to breathe well, swelling in his feet, his heart squeeze was very weak. He had morbid obesity, BMI was 45, pressure in the lungs was pretty high. But within 3 months of participating in our Siddha fasting hunger gratitude experience, His ejection fraction had gotten to 45. He was not in a wheelchair anymore. He was taking 4,000 steps on his own, and he reported feeling several years younger. And this is without any surgery, kidney biopsy or dialysis, which he was very near at this point when he first met us. This is because he has lost significant amount of weight through fasting for several hours on a regular basis. 2 times in a week, he would go for 20 hours. And then other 5 days, he would eat lesser meat and cut back on snacking, drink plenty of water. This patient discontinued water pills that are typically needed for heart failure patients. And within 3 months, he's able to feel 15 years younger. This we have reported in a medical journal, along with so many other stories like this. This is a nurse that I just started taking care of a few months ago. And if you look at her history, we are showing her weight in 2012, 2016, 2020. It's been around 85 kilograms for the most part. But by 2021, her BMI is 35 and her age at 64 together, BMI plus age is close to 100, which we feel directly puts people at excess risk for heart failure. And she has lost dramatic amount of weight since she met us 4 months ago. This is her weight. This type of drop we see sometimes with gastric bypass surgery. Sometimes even there we don't see it. But without any surgery, one of our own university nurses has lost this much weight. Her weight is now only about 58 kilograms. Her BMI dropped from 35 to 25 within 4 months, and she's feeling 20 years younger. So this is where we are connecting that age versus BMI, and anybody with a BMI plus age close to 100 might be at risk. So if that is your situation, talk to your doctor some more about these points. We go to why we use Siddha, because these are all the traditional medicines that have been practiced throughout the world over hundreds and over thousands of years. Siddha does not even feature in this, but I feel this has a history which is longer and useful for our society to embrace. These are the various alternative complementary medical practices. And Siddha, I feel, has been behind all of this, or several of these Eastern medical systems. Excuse me. As a cardiologist, we are trained in taking care of acute myocardial infarction and acute decompensated heart failure. That is what we do. We hope to improve lifespan. But when we practice holistic, we are able to improve the health span. We are able to encourage people towards sports and involving their body towards becoming creative throughout life. And using meditation, we are able to work towards elevating consciousness. Yoga checks off several of these boxes, but using Siddha self-inquiry, we are able to check off all these boxes, even acute decompensated heart failure. This is a patient who was in our own hospital 15 times. All these arrows shows how many times, and this is within a span of 12 months. Heart failure was such a huge challenge for her for the entire year. Here she went to a different center for a more advanced procedure in St. Louis to try and save her life, and despite that she came back 3 more times. At this point, I met her for the first time when she was in the hospital and taught her our hunger, gratitude, and Siddha fasting. Since then, it has now been nearly 12 months. She has not yet been in the hospital even once. So that is the real power of self-inquiry, mindful eating. And despite all the medicines and 3 cardiologists, what we could not do for her through interventions, she has done for herself through self-inquiry. Stayed out of the hospital for a whole year now. And this again we have published. This is what we know. When we want to reduce cholesterol, we also want to reduce inflammation, which is such an important aspect of heart failure. For that, we have to really look out for certain foods which are high in red meat, processed meat, organ meat, And anything that tastes good, unfortunately, cookies, donuts, ice cream, they all have excess sugar added to it. And most beverages have sugar added to it. So that is the challenge with soda and Powerade and Gatorade and things like that, which we all have to watch out for. So what are the foods that we can eat? Plenty and plenty of vegetables, green vegetables, dark yellow vegetables, whole grain, quinoa, brown rice, brown bread, multigrain bread, all the fruits. If you cut them and eat, they are fine. When we try to drink it as a juice, it's not that great. So have the real fruits. All the nuts have polyunsaturated fats and they are very healthy. A little bit of tea, coffee, and maybe up to a glass of wine is okay. This we know from a study in California, that if we eat for only 10 hours in a day, we have a much better chance of controlling our weight, glucose, cholesterol levels. If people can go up to 16 hours instead of 10, that means have only 8 hours to eat a couple of meals, then not only human beings, but what you see here is small life forms starting from unicellular organisms, up from grasshoppers and spiders to mice, to rats, to dogs, to monkeys. Everything exceeds their normal life expectancy by cutting back on food intake. So this is a lesson that science has now taught us over the last few decades. So we recommend a little bit of intermittent fasting, where we say up to 14 hours every night and up to maybe 20 or 24 hours once a week when you're at home. But even when you're in the hospital trying to deal with heart failure, you don't have to eat just because food is served. You could wait until you really feel hungry. That is going to help your heart. And in this intermittent fasting, we still look at hunger as something that is to be coped with. And we may be able to, at the end of a week, cut back about 30% calories. What we are teaching, though, is hunger gratitude experience, which is Siddha fasting, where not only the physical health benefits, but also the mind and resilience gets so much stronger. We look at hunger with gratitude, and we are able to cut back even further, 50, 60, 70% calorie intake. And this has been sustained for now 5 years by so many of our heart patients. So doing it while in the hospital only gives you more confidence that you can sustain this when you go home. Not only living 100 years, which is an amazing thing, but we feel alive in the moment. So that is what the meditation does to our heart patients. So what is this Siddha self-inquiry? It starts with gratitude. Every day, wake up in the morning feeling gratitude for some person, circumstance, or just to be alive in this COVID world. And let that gratitude warm your heart for a minute before you get out of the bed. That will give you the confidence to smile 20 times every waking hour. That reduces stress, builds optimism, and gives you the energy to deal with physical hunger. That itself is a meditation that deepens your awareness of your body, reduces diabetes, blood pressure, and cholesterol problems, and your heart failure, if that's what you have, will get better. That's what many patients are showing us over the last 5 years. So to remind you, emotional eating, which is something we want to avoid altogether, which is when we try to snack a lot and go for more sugar added substances. Habitual eating, I did that for 45 years of my life, where by the clock, 8 a.m., 12 noon, and 7 p.m., I would have 3 meals. I did that for 45 years without fail. And then I realized even that's not needed. We don't need 3 meals a day. We don't need any snacks in between. We need to eat only if our body really, really physically needs food. And then we've gone even beyond this. We've taught our friends how to deal with physical hunger just with smiling, just with gratitude, and with tap water. So we are not selling anything. We are only asking you to look within to find the confidence to be physically hungry. Even this we can cope with for several hours without any health damage. And that's when our body and our mind opens to really nutritive foods. When I'm really fasting and I'm truly hungry, the first thing I'm hoping to find is a banana. It's not a cookie. So this is the mindful eating scale, where generally people should stay between 4 and 7. If your BMI is only 22 or 24 and you're totally healthy, but if you're trying to lose weight, you would benefit from learning how to understand hunger at a deeper level, and even going up to very hungry or feeling starving. All this will be only for a few days, maybe a few months. For me, first couple of months was a challenge. But now I don't even go up there because my body goes into natural ketosis much sooner. As much as I make sure I am connected, relaxed, and drinking water, the liver will take over and start mobilizing the fat stores so that we can go into this ketosis and take care of enough energy requirements through the body itself. So this is what Siddha recommends. Fasting itself is an excellent medicine. Pattini peru marundu. So 50% of the stomach, if we have good food, which is nutritive, 25% of the stomach with water, and leave 25% of your stomach as empty. Tirumular, thousands of years ago, has said beautifully how the Siddha 5,000, 10,000 year tradition has been practiced. அண்டம் சுருங்கில் அதற்கோர் அழிவில்லை பிண்டம் சுருங்கில் பிராணம் நிலைப்படும் உண்டி சுருங்கில் உபாயம் பல பல கண்டம் கருத்த கபாலியும் ஆமே. Turning inwards, the self awakens. Losing weight, life lengthens. Eating less, benefits are plentiful. It detoxifies and directly elevates consciousness, makes us more connected, happier, and fulfilled by connecting with our own hunger and inner nature. This is what one of our friends has done very recently and shown that for 50 days he can go without any food to overcome his heart failure. That is not what we recommend, but this we are publishing now, not as a recommendation, but to tell people that how the body behaves, what happens to the weight, what happens to hemoglobin A1C for diabetes and cholesterol numbers and things like that. But what I'm bringing this here is because of the mindful aspect. This question that we always wonder, today is a bad day, good day, it's okay day, my cup is half full, I'm pessimist, optimist. None of these things matter when you go into self-inquiry. For him, this cup was totally full and overflowing. That is his magic. And these are the mechanisms how in acute heart failure, when people are in the hospital trying to get rid of excess fluid, trying to catch their breath, this hunger gratitude might work. It improves confidence, and through fasting, there is a chance to go into ketosis, which directly works on the heart and improves the kidney function and lessens the need for water pills so that we can go home sooner and avoid complications like cardiorenal syndrome that increase risk for prolonging the hospitalization. And once we learn these methods in the hospital with the supervision of the doctors and nurses, we might be able to practice these things at home as well towards gaining healthier amount of body weight. So to summarize this hunger gratitude Siddha fasting in acute heart failure, the simple 6 tips are: stay grateful in the moment, smile 20 times no matter if you're in the hospital or at home, avoid eating for about 12-14 hours every night if you can. If you're trying to lose weight, you might be able to go for 18 hours on most days, and that way you might be able to find your body gets enough time to rest, recover, and start going into ketosis to lose weight naturally. Avoid all types of snacks and sugar-added drinks. 1 to 2 cups of coffee may be okay, even when you're fasting. If it helps you fast, I'm happy with this. Being hungry is a true sign of being healthy. So don't be worried that you're hungry. Find ways to cope with it and learn to live with being hungry, which is an excellent sign of health. Drink plenty of water. That's a very good thing. Even if you have heart failure, if you're thirsty, you need water, drink it, you'll be okay. 6 more quick tips. When they serve food for you, morning, afternoon, evening, and night in the hospital, that is a good thing. The food being besides you will give you more power not to eat it. Don't worry about wasting a little bit. If you're not hungry yet, and you can go on a little longer, we welcome that. Fasting itself is direct power and gives you so much more confidence. We don't want anyone to starve. If your body is not feeling well, if you're getting headaches, if you're feeling uncomfortable, please have food. Preferably have a banana or fruits and some salad to start off, and then you can try again the fasting the next day. There's no rush. This is a lifetime experience or experiment or exploration. It's not like you have to become a master while you're in the hospital. If you are diabetic, be careful. Tell your doctors what you're doing so that they will cut down on your insulin dosage if you decide that you're going to eat lesser that day. But usually in the hospital, we check glucose levels several times in a day. So this is not a problem when you're in the hospital. But when you're getting discharged, you may have to discuss with your doctor about cutting back on your long-acting insulin dosage. And for your short-acting insulin, again, you may have to become comfortable checking your sugar levels and giving yourself a little lesser insulin every time. By and large, for people who get into this Siddha fasting, they find their overall insulin requirement is only 1/3 or half. Again, this type of thing is not meant for type 1 diabetics who need insulin to survive. For them, we don't recommend fasting. We don't recommend reducing insulin dose. But for type 2 diabetics who are dealing with severe obesity, this might work, but you have to discuss with your doctor. Check your blood pressure, especially when you're standing up. Because of these changes in your diet, you may need more fluids just to maintain adequate blood pressure so that you don't feel faint or tired. Drinking enough water again makes a lot of sense. Even if you're in the hospital, fine. If you are able to walk around, it's very good to strengthen your heart. So stay up and walk a little bit several times when you're in the hospital. This program started in Columbia, Missouri, 2015. And now, because of going online, we have so many VA centers from California, from Boston, from Florida, and Georgia that are joining us, from Texas. So we want to spread this simple holistic methods first by training our colleagues in medicine and cardiology, in critical care, but we also directly reach out to our patients because there is no time to waste. In heart failure, we yet don't have any specific treatment if the heart squeeze is normal. So you can learn these methods, especially if you have excess weight. And we are happy to support you in any and every way that we can. These are our collaborators. I cannot thank them enough over the last 5 years that have helped me to get to where we are in this program. And most importantly, I want to thank my patients who are telling me that real health, recovery, curing heart failure is a possibility. We are so many heart failure patients who don't have heart failure anymore for the last 3 years, 4 years. And that is not what science teaches us. It is what my patients are showing me that it is possible. So that material we are publishing thanks to our patients who are so inspired towards this self-inquiry and Siddha heartful living. So Siddha fasting, to summarize, is based on cardiology, latest evidence-based medicine, positive psychology and mindfulness, stress reduction, and motivation for compliance. And we use Siddha, yoga, and exercise methods all in the outpatient setting. But even while in the hospital, this fasting method can be safely embraced to improve outcomes. So practice this until your heart tells you that your experience of life is totally full and overflowing with uvagai, which is inner, reasonless, true, everlasting happiness. I wish you all success in life. Good luck.